Welcome to the For Health's Sake podcast, brought to you by Nightingale Health, elevating digital transformation with a human touch. This episode is sponsored by Radical Health Festival. It's critical to be radical.
Hello and welcome to this episode in the series of For Health's Sake, brought to you by Nightingale Health. My name is Charles Alessi. I'm the Chief Clinical Officer for Nightingale Health, and I have the opportunity to have a conversation with somebody who brings a technology which is very close to the heart of what we at Nightingale Health believe in, which is the preventative health of populations and individuals. And Teemu Suna from Nightingale Health is joining me today. Hello, Teemu.
Hi, Charles. Great to be great to have the conversation with you.
Thanks. What we'll do now is really try to delve a little bit into this area because it's absolutely fascinating. Let me just contextualize where we are here. So, as we all know, we've been moving to a more personalized precision approach in health systems, and this is happening literally all over the world. Some places are moving faster, some places are moving slower, some places don't have registries, they don't know where to start. And in a lot of these places, of course, there is a real question. Now, how are you going to start getting some sort of personalized sense of what your population is about? And lo and behold, there is a technology which could potentially be of assistance here. And it really is around what Teemu Suna and Nightingale Health bring. And this technology is really quite extraordinary because the first time I heard of it, I thought I misheard. And I went back again. And then I started looking at the evidence. And then I started connecting with all the academics I know who understand this space. And I got left with a real surprise that all this was happening. And I hadn't heard anything about it. Perhaps I'm ignorant, but I found out actually from a lot of other people that there were lots of people who knew very little about it. So I think to this, Teemu, I really think it would be helpful if you describe the technology a little, because it still is a mystery to quite a few people. Over to you.
Yeah, thanks, Charles. So maybe I think we need to start from this, like the whole concept of prevention, because I think sometimes it's not fully understood what is kind of the definition. So the question is like, okay, we all are talking about preventative health, and we are saying that, okay, we need to do prevention. But what is actually needed to do prevention? So it actually means that when you think about the population, you are addressing the entire population. You are also addressing the healthy individuals. Because what you need to prevent something, you need to detect a risk of developing, in this context, developing a disease when people are still healthy.
Yeah.
So the technology that we have created has been built, it has been designed from the beginning to do prevention. So it is a technology that you can scale to an entire population. It is a technology that is specialized in detecting the health risks from the healthy individuals. And kind of the magic happens, of course, when you can figure out the risks in the population. You can target the healthcare interventions to the ones who need those early on. With this, you can reduce the number, you can prevent diseases and reduce the number of sick people. And I mean, many times when we talk about healthcare, we kind of overcomplicate things. What is the ultimate solution? What do we need in healthcare to make it sustainable? we need to have less sick people. And the only I think the only feasible way to do that is to really build effective prevention. So now this I just wanted to frame the background a bit before going into technology.
Yeah, no, absolutely. And of course, what we talk about at Digital Health all the time is the value of prevention, the value of public health interventions, the value of personalized approaches. And I mean, you embody them all. So talk to us about the technology.
All right, so let's talk about the technology. So when we talk about health and disease, it's very important to understand the underlying biology, because it's complicated. Many of the diseases, we talk about the big diseases, cardiovascular disease, type 2 diabetes, many other chronic diseases. The biology, the underlying biology is very complicated. So we can say it's like a systemic biology in the background. So what we created at Nightingale, we have created a novel way of testing blood samples. So what we do, we take one blood sample, we run the Nightingale proprietary test, and we detect a very, very comprehensive view in metabolism. So we look at the metabolism in biology, and the the power of metabolism is that it is connected to many of these chronic diseases that are the most important diseases or the biggest burden in the healthcare system. And now what we change in comparison to the current routine clinical chemistry technologies. So let's take a cholesterol test. You take a cholesterol test, you typically take one blood sample, and as a result, you get like a handful of blood markers. You get LDL, HDL, triglycerides,
ratio, triglycerides. Yeah.
Exactly. And that's all you get. And with that data, you can use it to evaluate cardiovascular disease risk. Every year in the world, there are different estimates, but let's say there are 1 billion cholesterol tests done every year. So now Nightingale technology, we take the same blood sample, exactly the same blood sample, but we run our test. We get the same cholesterol test blood markers, but we also get very big number of other blood markers. And the thing here is that we capture the lipid metabolism, sugar metabolism, inflammation. We look at fatty acids. We look at ketone bodies. So we look the metabolism very comprehensively. But I'm not going to go into the details of different blood markers, because that's not the interesting thing with the Nightingale's technology. I'm just saying this because it's important to understand that we capture the biology more comprehensively than the current routine testing. And because of this, we have managed to create a capability where we actually, instead of, or not only detecting the blood markers, but we actually detect the connection to actual health outcome risks. Yeah. So instead of saying, okay, your LDL, bad cholesterol is 3.4 millimoles per liter, we can actually, because this is not necessarily it's connected to your cardiovascular disease risk, but it doesn't give you the the picture of the outcome risk. But
so what you're doing, Teemu, really, I'm going to use my words now.
Yeah.
What you're doing really is providing polygenic risk scores on steroids, because polygenic risk scores give you something, but you're actually going beyond that, because this isn't only around your risk of developing something, but also is looking at your risk factors and where you are on that spectrum. Am I correct?
Well, yeah. Well, you can put it like that, but maybe kind of a very important difference is that whenever you look at the genetic data, it is static data.
Yes. That's what I meant on steroids, because
yeah. There are a lot of steroids in this case. So So what I mean by this, and this is important conversation, because when we think about the genetic testing, and just to kind of make it very practical, so you are born with your genetic kind of, it's your DNA. So when you look at the cardiovascular disease risk when you are 5 years old, or you are 50 years old, the data is the same. So then the question, kind of very common sense question, is, so how do you predict the heart disease risk from a 5-year-old? Because we all know that the way how you live your life matters in a massive way.
Yes.
I would say that 80% of the risk is actually defined by the way how you define how you live your life. And then with this Nightingale technology, so the biology that we are looking, so the blood markers we are looking at the dynamic part
Yes.
of the system, and this dynamic part is also changing. So what is very, very
Thank God it is.
yeah.
Because if I change my life, if I stop smoking, if I exercise more, if I do, I am going to get benefit in terms of risk.
Exactly. And we can quantify the change. This is also a huge thing in healthcare. One big problem in healthcare is that we are doing things, but we don't have tools to quantify the progress. But with Nightingale, because we are following the change in actual health outcome risk, so we are not looking only if the LDL level is going up or down, but we are looking if the cardiovascular disease risk is going up or down.
Yes.
So we can see the actual outcome, and this opens like massive opportunities for how you build the health system, how you build like outcome-based healthcare system.
And there are countries that are starting to do this. I mean,
definitely.
Places like Singapore, for example, we have whole systems being set up specifically to do this. In the United Kingdom, I was involved in a big project associated with doing this at scale, at pace, for whole populations. So this is where a lot of health systems are going, because as you said, the last thing that we all should be looking to is actually fixing disease. We need to prevent the disease in the first place, and this is the way to prevent the disease.
Yeah. And I would even say that in the end of the day, everyone will do it, because it's such a major thing. If we think about the cost of healthcare in the United States, 20% of the gross domestic product.
I know.
But if you compare it to the military spending, and we know there is a lot of military spending in the United States, it's in the ballpark of 4%. Healthcare is 20.
I know. It is unbelievable the amount of resource which we are spending, and often duplicating, and various other things, and for in many cases, a wholly preventable condition. I'll give you an example. Of course, renal disease. We have 95% of spend on dialysis for a condition which actually is wholly preventable. I mean, it's insane. And you have some technology which specifically looks at conditions like this. So where have you deployed?
So
where have you started deploying? Where are you using this technology?
So I think one of the largest implementations is actually in Finland. So in Finland, we are running this for occupational health checkups, and we actually in this project we are running the test for 30% of the Finland's working age population. So it's basically like 30% of the Finnish workforce is being kind of tested with the Nightingale's technology. So we replace the kind of the routine traditional approach with this new approach. And the power is that you can think about the benefits in multiple levels. So I mean, for clinicians, it brings you the risk detection for like multiple chronic diseases from every blood sample measured. So whenever your patient comes in, you have a holistic view in the different health risks. So you don't have to separately run cardiovascular disease risk, type 2 diabetes risk, disease risk test.
You do one thing, you don't do
one thing.
58. Yeah.
Yeah. And then you get liver disease, kidney disease, lung diseases. So you get basically kind of the top chronic disease risks like in one go. And I think it's a great tool for clinicians to do the diagnosis of the situation and also help to motivate the individual, which brings me to the kind of the second benefit, which is actually the individual who can see their own health in a new way. This is not like, I'm always saying, Nightingale is not your judgment day. It's an observation. It's an opportunity to do better. And then if you decide to do your lifestyle changes, I don't know, you can start exercising more.
Yeah,
You can become like,
this
change your
can
diet.
make an enormous difference. I mean, let's take liver disease now. In liver disease, we know that taking blood tests to check your liver function is not very clever for a very good reason. They're very late. The changes when they start to appear, your liver is in pretty dire condition. And you have to use things like thermoscans and various other approaches, which are expensive, difficult to organize. There's situations of access, equity. It's really problematic. But we potentially have a solution here, because if one uses these they're not polygenic, as you quite rightly said, these approaches which actually measure risk using a whole multitude of parameters, one is in a situation where one could actually start doing that much more dynamically. The effect on populations is going to be enormous, and on individuals, by the way. You know, if I spend the next 18 weeks exercising every day and ensuring I eat sensibly and do everything I should to behave, I would expect, I hope, to see some difference in my parameters. That would be really powerful. And I think this is the power of Nightingale, as well as giving places where they don't have registries, where they don't know what the burden of disease is, at least they'll know where to start.
Definitely. I think the kind of the benefits are like, it's benefits for the clinicians. It helps in their like daily work. It's beneficial for the individuals because of the motivational factor. And then the third thing is that it's beneficial for the health system. And this is like, it's when you have the data, when you have the understanding about the health risks, you can actually steer not only like your medical interventions, but you can actually start building your health policy actions according to the health risks. Because ultimately, what is the ultimate measurement? What is the ultimate KPI to build a healthier nation? It's the risk. It's the level of risk and the change in the risk. Let's have an example. The government makes a health policy where they, I don't know, they in a small country, they buy bicycles for everyone. I don't know if this can happen, but let's think about it. The current system, you buy the bicycles and then you just start asking, you make questionnaire for people like, oh, do you like it? Well, people like it if it's free, I would expect. And then you may be seeing some like subjective measurements for the impact. But the problem is that if you really want to see the impact to public health, you have to wait 10 to 20 years to see the outcomes.
Yes.
But if you are running Nightingale all the time,
you see them sooner.
you see them in kind of the time scale is 1 year, because you are running it with routine blood testing, for example, replacing all the cholesterol tests with this. So you have the data accumulating in the background all the time. So you actually see and you know what is happening in the country. This is like governments talk about building smart health. This is smart health. You need the data to do it. And this data does not exist in the current health system. You need biotechnology, you need biological data, and then you can do it. And I think it's super exciting.
But there's something else which excited me about your approach as well when I delved into it. And it's this postal system. Because, yes, in a lot of more developed health systems, where access is not quite as much of a problem, and in smaller countries where demography means that places are close to each other, it's not usually difficult to get to a lab to get a blood sample taken. But you've developed a technology which enables you to actually get people to self-administer venipuncture. This is pinprick, but a little bit more than pinprick, because you need a little bit more blood, but not much more, to enable you to do this through the post. Now, imagine the potential benefit of that in inequalities, for example, in populations which hitherto have proven really difficult to reach because they can't get to somewhere to take blood off them. They could do it through the post. And I mean, that is extraordinary. We've actually managed to do that. This is real.
Yeah, it's real, and it's been quite a long journey to get there. So it's not easy. It's very difficult. But so what we can do is that it doesn't matter if the blood is coming from a venous draw from a lab, or if it's coming from a finger prick done by people at their homes, when we evaluate the risks. And this is very powerful. So what we have seen already in healthcare is this kind of a breakthrough of the telehealth. So people actually you have access, you have the video and you have the microphone, and then you meet with your doctor, you can have the conversation. It makes the health system like less centralized.
Yeah,
it's more like a distributed system, and when it's more distributed, it actually makes it more efficient.
However, and it's personalized.
Yeah,
it's for me.
Yeah. It's for you. But now the big difference is that now if you have, like with the current telehealth, you have the camera, you have the microphone. Now when we can add a comprehensive assessment of your chronic disease health risks from a sample that is drawn by people themselves at home, you can actually build the health system from the different kind of your foundations change. I think this is very applicable in the developing world where the system does not exist yet, but also in the developed world where a lot of costs are coming because we need more flexibility to the system. And I think this is exactly what we can do with this remote sample collection capability, and still same performance with the risk evaluation. And I agree with you, that can be quite groundbreaking.
Oh, it's going to be groundbreaking because, of course, we have, even in the most developed health systems, we have pockets of real deprivation. We have pockets of very hard to reach populations, often religious, social cohorts of people who clearly find difficulty either in getting to a lab or even in accessing the service to start with. There's a whole series of reasons. We all know them. Yes. But the ability for that to happen in the privacy of somebody's home at no cost to get somewhere, no cost in time, that's an enormous advantage, a vast advantage. And I really do believe we are on the cusp of fundamental transformation of our health and care systems as a result of this. We never had this before. This is the first time we have it.
Yeah, I fully agree. And then I think you also raised an important question about the costs. So one of the important benefits of the Nightingale technology is that if you really kind of factor in the costs, whether you look at the venous sampling side or the remote sampling side, we are very close with the cost parity with the current routine testing. So the important thing here is that using Nightingale doesn't mean that you have to kind of extend your budgets through the
So it's not we're not in genome territory here, are we?
No, not at all. Not at all. So this is actually kind of, because we have designed this for this purpose. So that makes the technology very efficient, and that allows us to keep the cost level also very feasible. I can say, like, running this for an entire country is a no-brainer from the cost point of view. And I think it's very important thing to say, because many times people expect when there is a new fancy technology in healthcare, it costs, like, it's so expensive that
It goes
no
with the
one can afford it.
territory. It goes with
Yeah,
the territory. Yeah.
exactly. But
Yeah.
this is a different case. This is built for the population level assessment. So you need to be able to run this for everyone. And what is exciting is that when you run this in population level, think about the jump, kind of how it changes the level of information, level of health insights that people can get access. And this is not for the richest 1%. This is for everyone. You can run it as part of the public health system. And this has been very important for Nightingale from the very beginning. And now it's happening. You can really do it.
And if we consider the opportunities that most countries had, there are only 4 or 5 countries that have longitudinal registry data, which enables them to get a sense of what their population's morbidity and mortality really is. But suddenly, that work over 30 years can actually be available to everybody at minimal cost. I mean, it really is. You have to go into a room and put a cold towel on your head and say, no, I'm not dreaming. This is real. This is happening. But it is happening. And so I think we are in a time where we're going to see a lot more developments around here. So where is your focus now? What are you moving to? Where's the next big challenge? I mean, you've already achieved quite a bit. Yes, we have to get this deployed globally. I think you will get this deployed globally. Basically, to be frank, it's a no-brainer. But where is your thinking now? Where do you think you need to go?
Yeah. Well, what I think about when I look at the primary healthcare system, kind of the big picture of the primary healthcare system, and this is also, like, I think it's surprisingly simple thing, but I think it's all about that we really need to set up we need to be able to measure the impact of actions. So if we can set up as a part of the healthcare system, we are all the time collecting data that is demonstrating us, so we can measure the impact. So we have a kind of a KPI. So we have this global KPI that we can use to measure the impact of healthcare. We can use it to measure the impact of kind of health policies. And we can actually include that data to be part of every decision-making we are doing. Where shall we build a football field? We can use kind of the health data to put it into places, taking that into account in our decision making. So my vision of the future in healthcare is that it can be so much smarter than it is today. We just need to build. So the role of Nightingale is to be the kind of I would say this kind of impact assessment backbone. So we bring the data to be part of the system. It is generated automatically as a part of the routine blood testing. And when we have the data backbone, it's kind of building a new architecture to build smarter nations, like smarter healthcare systems. But we need to build this data backbone. And then when we have that, we can do amazing things. We can steer.
But we're not that far away from having that. I mean, this is what is extraordinary, because normally what you said, yes, of course, you need to build an architecture where you have the measurement parameters which enable you to understand what the population is living with and whether they're getting better or worse, etc., for you to design processes around people. Now, normally that takes 30 years. But suddenly, it's not going to take 30 years. And enormous expense, by the way. But, it costs an awful lot to maintain this stuff. But you can actually, there's a shortcut now. There's another way in. And that way in gets you to a place where you're going to have so much data. And then, of course, you could put this into practice in terms of developing personalized approaches. Yeah. And I think that's where your head is. That's where my head is.
Yeah. I agree with that, and I think the important part of also the of our way of thinking is that this is not a technology that is solving everything, but this is a technology that is very important part, because the biggest problem in this in healthcare are the chronic diseases. That is like, we know that. So this is very efficient tool to quantify the risk of developing a chronic disease. Now, when you have the data in the background, you can kind of combine different data modalities into this. So you can combine genetic data.
Yeah.
In the future, you can combine proteomic data.
Yeah,
You
yeah.
can combine social data. And the whole point is that you just need to have some gold standard KPI in the background. You have kind of a reference that you are comparing everything to. And this is the role of Nightingale in this kind of a bigger picture. And we will allow this all. So we are not like, the point of this is not to kind of make it impossible to implement. The point is to empower and enable the health system to do smarter things. And this is what we are doing. And I'm kind of, the way, in my vision, the future of healthcare looks bright. It actually looks good. We have the technologies. Let's just do it.
So this is a wonderful way, I think, for us to get this conversation to a close, because we've been talking for about half an hour now. You wouldn't believe it. I really think there are very few times in my life where I have felt that we're at this inflection point. You know, we always say we're at an inflection point, things are going to change, but occasionally you get to a situation where things really are changing. And there is a lot happening at the moment, partly associated with deploying things like artificial intelligence, of course, and the effect of that on pathways, but also the ability to be able to assess people's health so well and to engage people in their own health so well. And I think we are at one of these points. So this is really radical in terms of the effect it could have on health systems. And I think we're really lucky we're at the start, or perhaps we're beyond the start now, of this journey, because it's going to be a very exciting time for healthcare. I share your enthusiasm and I share your optimism. I think we're going to get there. So thank you for spending a bit of time with me on a subject which, as you can see, I feel very passionately about, because I believe this is our future. And we'll continue this conversation, of course, in Helsinki very soon at the Radical Health Festival. Thank you, Teemu.
Thank you, Charles.